Assalamu alaikum and welcome to the Healing Beyond Borders podcast. I am Jabbar Khan, the host of this podcast, and it's a project of Nurses Beyond Borders where we are connecting nurses beyond borders through stories and global opportunities. Hello, everyone, and welcome to another episode of Healing Beyond Borders podcast. I am your host, Jabbar Khan, and today we have a very special guest joining us from United States. It's my pleasure to welcome Dr. Susan Deane, a respected nurse educator, author, and healthcare leader who has dedicated her career to advancing nurses education, preparing for the next generation of nurses. In today's conversation, we will explore Dr. Diener's inspiring professional journey, discuss the growing role of artificial intelligence in healthcare and nursing education, and how nurses can prepare themselves to lead in a rapidly changing healthcare environment. Dr. Dene, thank you so much for joining us. It's an honor to have you on Healing Beyond Borders podcast. Dr. Dene, let's begin with your story. Can you tell us a little about your nursing journey and what inspired you to become a nursing educator and author?
Thank you so much for having me. It is a pleasure to be here today. Like many nurses, I really didn't begin my career thinking I would become an educator or a healthcare leader. I started at the bedside in an acute care hospital, and I learned really that nursing is ultimately about human connection, critical thinking, and advocacy. And as my career progressed, I discovered that I had a passion for teaching. I really was interested in helping others learn. And obviously, that led me into nursing education, where I spent more than 2 decades teaching students, mentoring faculty, developing programs, and then eventually being in leadership roles. I think for me, one of my most transformative experiences was serving as the dean of a school of nursing and the interim provost during the pandemic. And I think those roles really reinforced the importance of adaptability, communication, and certainly leading through uncertainty. And leading through uncertainty, and that means leading through change. And so what I really kind of remains consistent in my journey is that I really do believe that education changes lives. And those so whether I'm teaching a student, mentoring, writing a book, or speaking at a conference, I think my mission has always been the same, and that's helping people feel confident on navigating through change. And right now, today, that change is being driven by artificial intelligence. And I believe nursing has a critical, if not essential, role in shaping how it's used.
Uh, as all of us know that artificial intelligence or AI is transforming nearly every aspect of life and every aspect in the healthcare. How do you envision AI shaping nursing education and clinical practice in the coming years?
Yeah, so that's sort of a difficult question because I kind of look at it similar to when the early days of the internet came on, right? Nobody knew exactly where it was going to go and how it was going to impact lives. And look at today, right? So I think most people recognize that AI is important, but we're really only beginning to understand how significantly it will impact healthcare. So right now, I think in education, we know that AI can support personalized learning, simulation, tutoring, feedback, and faculty productivity. I think it has a tremendous potential to reduce administrative burden associated with faculty roles and allow educators to do what they love most, and that's teach, coach, and mentor their students. I think for clinical practice, I think AI will and is already assisting with documentation, pattern recognition, clinical decision support, patient education, and population health management. And I do not believe that AI will ever replace nurses. I think it will help us be better. And so the future is really about nurses working with the technology together to improve patient care.
Great, you have explained it very explicitly and comprehensively. As you know that in every arena of life, and many nurses are excited for the AI, while others are a little bit terrified, or you can say worried. What do you see as what do you see the biggest opportunities and challenges AI presents for the nursing profession or professionals?
Yeah, I think the opportunities are going to be enormous. First of all, I think look at the nursing students today are going to graduate into healthcare environments where AI is really already embedded in many aspects of care delivery. They're going to encounter AI assisted documentation, predictive analytics, virtual health tools, and clinical decision support. Now, the challenge I really feel strongly about here is that there's really no education sometimes, or formal education around how these AI technologies work. So, I kind of look at it as, we would never have a nurse use a new infusion pump without being educated on it, right? Learning how it works, how to turn it on, how to turn it off, what to do when it malfunctions, right? And we do that with everything that nurses do. We teach them on new stuff, and yet we're not really sure. What I'm hearing is that sometimes nurses will get an email that that the hospital or the healthcare system is going to implement a new AI tool on Monday, and it's Friday, and there is absolutely no education about how to use it. And so, what I really feel strongly about the future nurses and nurses right now, really, we need to understand how AI works, what AI can and cannot do, how biases may occur, how to evaluate the AI generated information. So there's going to be a lot of AI generated information, and yet we need to know how to interpret it, evaluate it, and how to act or not act on it. And we really need to send a strong message that our human judgment, our judgment, clinical reasoning should override technology at all aspects. And that's why one of the reasons I co-developed the AI competency domains for nurses, because we needed some structure. We needed an evidence-informed answer to the questions that actually nurses need to know. So not just digital literacy, but really kind of to map those competencies to the realities of clinical practice. We can't just leave that to chance. So, we future nurse leaders really need more than technical skills, right? They need to develop communication skills, systems thinking, adaptability, emotional intelligence, and collaboration.
Great. As healthcare become more complex and technology driven, what leadership you have gave answer to this question a bit, but again, this is a question that healthcare sector is becoming more complex and technology driven. What leadership qualities and skills should nurses develop to succeed and make greater impact in this healthcare
Yeah.
industry?
So I thought long and hard about this question, and I because it was hard to come up with, what skills are would be like my top three. So I did come up with top three, and I think the first one I think is the ability to think systematically. So systems thinking, right? You knew that nurse leader really needs to see a broad picture of how a clinical decision support tool a technology deployment or a policy is going to change or ripple down. It's just not about what the nurse does. How's it going to affect the healthcare environment, the patient going home? So really thinking on a higher level. I think the second thing that's really important is to be able to use cross-disciplinary communication. We're really good at interdisciplinary communication with our clinical teams, but now AI is going to bring in data scientists, engineers, ethicists, and executives into the conversation. So as nurses, and nurse leaders, we really need to be able to help them translate our clinical reality into a language that they understand because they've never taken care of a patient before. They've never taken a blood pressure before. So that's really going to be absolutely essential. And then finally, I think the third is the ability to question and the confidence to push back if necessary. AI tools are going to be presented like, great bells and whistles, right? They're going to sound great with great dashboards and compelling data. But nurses need to be equipped and empowered to say, you know what? This does not match what I'm seeing in this patient. And to have that observation taken seriously. So it's more about patient safety. That's where that comes in. So I think the most important thing a nurse can bring into the AI-enabled healthcare environment is the willingness to say and out loud, something doesn't look right here.
Yes, another question is about ethical values. AI, as you mentioned in this answer, that AI can help us in clinical decision making, but also raises important ethical questions. How can nurses balance innovation, patient safety, privacy, and ethical care?
Yeah, so some of the AI kind of raises ethical questions that the healthcare system really is not prepared for yet, right? Like, who is going to be responsible when an AI generated recommendation um, it leads to a bad outcome? You know, how do we, ensure that the algorithmic bias doesn't systematically disadvantage already vulnerable patient populations? And then finally, how do we prepare or preserve patient dignity and autonomy when decisions are kind of increasingly mediated by technology? Now, these aren't hypothetical questions. They're already playing out in a lot of health systems right now. And so nurses are the front lines of every single one of them. And that's why I created the AI safety pause. It's a structured framework that gives nurses a concrete, repeatable process for evaluating AI generated information before they act on it. So the first question is, does this align with my clinical assessment? Right? I mean, does this make sense for this patient? Not any patient, this patient in front of me. And then the second question is there anything that AI may be missing? Is there a conversation I had with the patient or the family that AI doesn't know, so it wouldn't be in that recommendation? Or cultural considerations. So those things, anything that's missing that we are part of. So we have to evaluate that output that way. And then finally, does it feel right? And if it doesn't, then we don't have to act on that recommendation. But we do have to document our findings and decide if we're going to go with the recommendation, why or why not. And those are really important principles. I think to remember that, the ethics in AI isn't just going to be a policy document, right? It's going to be a daily practice that happens at the bedside in real time under pressure. And so, and nurses are in the last line of defense, and they need the tools to reflect that reality.
Great. You have explained it so clearly. As you are an educator and also an author, my another question is that from an educator perspective, how can nursing schools and educators integrate AI into learning while still fostering clinical thinking, clinical judgments, and compassion?
Yeah, I think one of the biggest misconceptions about AI in education is that the goal is to use AI for students, and I think the goal really is teaching students how to think with AI. And that means that we can create a lot of different scenarios and assignments where students need to evaluate AI generated content. It would be a great simulation thing, is to hear the nurse gets AI generated content, and what do they do with it? Do they have to, find mistakes with it, or do they go ahead and do it as the technology said it would? They have to be able to identify inaccuracies, compare AI recommendations to evidence. Those are all things in nursing education that, preserves that critical thinking and clinical judgment. And then to defend their clinical reasoning. If we simply use AI tools to provide answers, then yeah, we're not teaching critical thinking. But if we use the tool for inquiry, reflection, and analysis, we can actually strengthen those clinical thinking skills. I think one of the most important aspects here is that we must preserve the human aspects of nursing education, and that's compassion, empathy, presence, advocacy, and communication. You know, the human side of healthcare is the most important thing we do. Throughout my career, I never had a patient remember a perfectly completed documentation note, but patients remember how a nurse makes them feel. They do remember compassion, they remember reassurance, and they remember being heard. So technology can certainly support the care, but that human connection that we have as nurses is the whole element of what nursing is.
Great. Before asking the last question, I would like to ask something about your work. What are you doing in the healthcare sector, especially where you are explaining AI to the nurses? Can you share a bit more about your work?
Yeah, so the AI competency domains for nursing is a simple how-to guidelines. When I've talked across the country and world on AI with nurses and nursing education and in practice, the same questions kind of came up. We don't know what to teach. What are we teaching about AI? You know, and so where's the evidence? Everybody was all over, and I think the other thing is that the implementation of AI tools is very diverse. Some healthcare systems are not using them yet, and others are using them quite a bit. So the disparities were really rich. And so what I felt was missing was some foundational skills or competencies. What do we teach? So there's 8 competency skills, and certainly one of them is AI literacy, because I think we have to talk about that. Nurses need to know what AI is, how it works, and some of the buzzwords around it, right? We also need to be data stewardships. It's going to have a tremendous amount of data and data that's fed back to us. But how do we interpret that? How do we use that? I think we have to look at the ethical and the bias use of AI and to be able to address it when we see it. I think the biggest thing is one of these competencies hopefully will give nurses the guardrails that they need to ask the right questions, to be prepared to use AI in an ethical and safe way, to make sure that the safety of our patients is intact, and that the technology doesn't take away from nursing. I think the future of AI in nursing and in healthcare is going to be shaped by someone, but I want to make sure that it's going to be shaped by nurses.
Great. And another and the last question is looking ahead, what advice would you like to give nurses and nursing students around the world in this era of AI or artificial intelligence?
I think the number one advice is to always be curious. Get curious about AI, and not be afraid of it. I think when we start actually learning how these tools work, that's not just like the hype of it, but the real mechanics of it. We'll understand how AI can really work well, where it doesn't work well, where it fails, and what does it fundamentally not understand about human beings. When we know the answers to those questions, we can start to be empowered. And I think to remember that, our critical thinking, our clinical reasoning is our power zone. And that's how we're not losing that. That AI is a tool to help us be better. And I think is, make sure that, the therapeutic relationships that we have with our patients are not lost. Our unbelievably astute assessments that help with early interventions and early detections are still not going to go unnoticed. And then, the advocacy for our patients, especially for those who cannot advocate for themselves. Those are, incredibly humanistic. And I believe it's at the core of what nursing really is. And finally, I think is don't wait for your institution to lead. I think nurses who step into the space now, who can educate themselves, raise their hands at meetings, ask hard questions about the tools that are being deployed in their units. Those are the nurses who are going to shape what AI in healthcare will look like and will continue to evolve. I think that influence is available to every nurse at every level. And I think it starts today. We can't wait. Like I said, AI will be shaped by someone. I want it to be shaped by our nurses.
Great. This all discussion was so precious and so effective that nurses will take a lot of help to understand the use of AI in healthcare. And at the end, I would like to thank you that you have managed time for us in Healing Beyond podcast from your busy schedule. Thank you very much.
Thank you.
Thank you.